Have you ever woken up with a pounding headache or had a nagging backache throughout the day? If you have, I'm sure you've come across this drug, ibuprofen, which is often the hero of the day. But what if I told you that this drug does not only relieve pain, but also reduces inflammation and even lowers your fever? It sounds like a miracle drug, right? Well, come along with me and my friends as we delve into the intricacies of ibuprofen. Hello everyone, I'm Georgina, your host, and I'm here with a few of my colleagues to delve into ibuprofen. So we have here with me Herbert, Solomon, and Elizabeth. Alright, so we've heard of ibuprofen, and I'm sure most of us are itching to know about the history, how this drug came about. So, Herbert, could you please help us with the history?
Adam Steele and his colleagues tried to synthesize a drug that could help in pain relief, like aspirin. Aspirin was used to treat rheumatoid arthritis back in the days, but had some side effects. They had side effects on the gastric walls of the stomach of some patients. For that reason, they tried to synthesize some drugs. So they synthesized over 600 compounds.
Over 600?
Yeah.
Wow.
Out of the 600 compounds, they got 5 lead compounds.
Wow, so they had 600 compounds at first, so and then out of the 600, they had 5.
5 leads. So four out of the 5 failed the clinical trials.
Wow.
So the one they got, that was ibuprofen, was able to pass the clinical trials.
Oh.
So ibuprofen had the properties of aspirin, but with less side effects.
Side effects. Wow. Is there anything else anybody wants to add?
Adam Steele at Boots Company Limited. They tried to synthesize a drug because they saw that the activity of aspirin was coming as a result of the carboxylic acid functionality.
Okay.
So ibuprofen formed part of the propanoic acid derivative. So they just derivatize the propanoic acid to see the effects of the derivatization on the drug. Yes. And then you see how it works.
So we have some information from aspirin. That is, the carbonyl moiety was in fact the reason for the activity in the drug, right?
Yes.
So the same carbonyl moiety was also found in ibuprofen.
Yeah.
Okay. So ibuprofen is more or less more potent with less side effects.
Yeah.
Wow, that's amazing. Okay, so we know about ibuprofen now, we know about the history, but then what does it do in us? The mechanism, like what goes on in our bodies when we take ibuprofen?
Okay, so like any other non-steroidal anti-inflammatory drug, ibuprofen also works the same way by inhibiting the action of the enzyme 𝐈𝐶𝐾. So, like the enzyme, you need the pathways before it can work. So ibuprofen just competitively inhibits by binding to the substrate of 𝐈𝐶𝐾. You can really understand this by knowing how we feel pain. So whenever there is something associated with pain, there are some hormones in our body known as prostaglandins, which need to send signals to the brain that there is inflammation or pain. So these hormones are stabilized by this 𝐈𝐶𝐾 enzyme. So if we are able to block the catalysis of the synthesis of this enzyme, then we can be able to inhibit the action of transfer of information to the brain.
Okay, so if I get you, it's not as if the drug is curing the pain, but rather it is preventing the signals from being sent to our brain that we are in pain. Wow, thank you. Alright. So ibuprofen right now, everybody buys ibuprofen. If I have cramps, if there's a back pain, if there's a headache, we go to the clinic, we are like, we want ibuprofen to buy. So when it becomes an over-the-counter drug like this, there are safety and toxicity concerns. So I want us to, talk a little about the safety and toxicity of the drug.
So when it comes to the safety, ibuprofen is very safe, and its toxicity level is very low. But anything we take in much cases, there are side effects. Yes, giving us some gastric intestinal effects. But that one, it's in relation with a few people. There could be allergies too. Maybe when I take it, I get some rashes or something else on my body. Meaning I'm not in line with the drug. But the chemotherapeutic index is very high, so that makes the drug very safe When it comes to the challenges we are facing, ibuprofen, the solubility of ibuprofen is very difficult in aqueous media. So it limits the bioavailability of the drug administered orally.
So we now know about certain challenges and concerns, but what can we do to counteract these problems?
To combat the challenges, we can make some public knowledge on the drug.
We can also find other derivatives, like modify the drug so that the bioavailability will be very high. Because we are dealing with aqueous media, intravenously, then we want to modify the drugs to get more polar substituents on the drugs so that it can really dissolve in an aqueous media.
Thank you so much for sticking around and learning and hearing us about the drug ibuprofen. We hope you learned a lot. Thank you.